Erectile function and dysfunction. Mysteries of the penis revealed. A urologist's perspective. Part 4. Causes of erectile dysfunction. There are numerous causes of erectile dysfunction, and I would like to discuss them briefly. Number 1, psychological causes. Many men have a transient, temporary issue for one reason or another. We are not robots. We can't always perform on command. Sometimes we're fatigued. Sometimes we drink a little bit too much alcohol. Sometimes we have performance anxiety. So sometimes the penis does not work in the manner in which we would like it to. And that can happen to anybody, and it probably happens to everybody at one time or another. The issue becomes when one dwells on that psychologically, cannot get the thought out of their mind, when they're in a warm sexual situation, and instead of being in the moment, if you will, they are obsessing about, will my penis function, then they are almost certainly guaranteed that the penis will fail to function. It often becomes a self-fulfilling prophecy of doom or failure, and it is often mediated biochemically by the stress hormone, adrenaline. Performance anxiety is caused by the release of adrenaline, which causes constriction of the penile blood vessels, which does not permit the penis to function with proper erectile rigidity. Of course, there are other psychological issues that are more permanent, such as depression. The brain is a very important organ when it comes to sexual function. That is my point. Now, there are many organic causes of erectile function. Diabetes is a major one. Diabetes probably is the largest cause of erectile dysfunction in the United States. So it would be in one's best interest to do anything and everything they can to avoid diabetes by maintaining a good, healthy lifestyle, eating properly, exercising. And if you are so unfortunate as to acquire diabetes, just to seek proper medical treatment and heed your physician's advice. Any form of vascular disease, that is, blood vessel disease, can cause erectile dysfunction. Remember, erections are all about blood flow, and anything that can interfere with blood flow will promote erectile dysfunction. So if you have an abdominal aortic aneurysm, or you have clogged blood vessels in your carotid arteries going to your brain, and you've had a stroke, chances are you're going to have issues with erections as well. Tobacco. I cannot emphasize how much cigarette smoking can adversely influence erectile function. And I will talk about this more in a moment. Alcohol abuse can be another factor. Elevated cholesterol causing plaque and atherosclerosis, narrowing of the blood vessels in general, the penile arteries in particular. Neurological issues. Anything that can affect nerves can profoundly affect erections. So for example, Parkinson's disease, multiple sclerosis, spinal cord injury, having a stroke. Penile function is contingent upon the proper nerve supply being intact and functional in order to trigger the proper augmented blood flow that is a prerequisite for inducing erections. Medications, very, very important. Many adults in America have high blood pressure, and it is very important that they be treated with medications to lower the blood pressure in order to prevent cardiac disease, heart failure, strokes, etc. However, as a consequence of decreasing the pressure of blood, one may get diminished erectile function. Having low testosterone, that is the male hormone made by the testicles predominantly, can affect erectile function. Although it predominantly affects one's libido, which is sexual desire. And the difference between an 8-year-old boy and an 18-year-old boy in terms of libido is essentially high level of testosterone in the 18-year-old and a low level in the 8-year-old, whereas both can get erections. Any form of surgery, radical surgery in particular, that can affect the nerves or blood flow to the penis can cause erectile dysfunction. Classically, abdominal perineal resection for a colon cancer or a radical prostatectomy for prostate cancer. Radiation therapy to the pelvis can injure the nerves, the blood vessels, and the spongy tissue in the corpora cavernosa and induce erectile dysfunction. Any form of pelvic trauma can do the same. Priapism, that condition I alluded to before, in which a man gets a prolonged, painful erection for no good reason most of the time, although there are some organic underlying reasons, can ultimately cause scarring of the erectile tissues and no further erections. Too much of a good thing, if you will. And lastly, Peyronie's disease, which is a not uncommon disease of the outer sheath of the erectile cylinders, the corpora cavernosa, in which there is scar tissue laid down, can cause erectile dysfunction. As a result of the scar tissue, when an erection occurs, there can be pain and a significant bend to the penis, an angulation, as depicted in this man with a 90-degree upward deflection of the penis because of this scar tissue that does not allow symmetrical expansion of the corpora cavernosa. This, by the way, is a very treatable situation. I want to add to my list cycling. Since I am an avid cyclist, truly enjoy cycling. I love the camaraderie with my friends. I love the exercise. I love being fit and staying in shape, but you really have to be careful. There is a correlation of cyclists and erectile dysfunction that is thought to be on the basis of sitting on a hard seat for hours on end that puts certain pressure on the nerves and blood vessels to the penis. So it's very important to get a proper bike seat as depicted on the right. There are many seats out there that are now designed with this particular problem in mind, that are so constructed as to avoid the nerve and blood vessels that can get compressed from prolonged contact with the bike seat. When a patient presents to my office complaining of erectile dysfunction, I explain to them the anatomy and function of the penis. Before giving them a medication or any other form of invasive therapy, treatment, I have a candid discussion of lifestyle measures. Clearly, there's an association of erectile dysfunction with bad lifestyle matters, and that includes tobacco, obesity, having a sedentary existence, having a stressful life, not getting enough sleep, substance abuse, alcohol, drugs. By the same token, good lifestyle matters can turn around the problem, and this means daily exercise, managing one's weight, good nutritional habits, ample sleep, avoidance of stress, as difficult as that is, or learning how to deal with it in a productive fashion, avoidance of tobacco, and using your penis the way it was intended to. Once again, use it or lose it phenomenon applies here. If you enjoyed this little discussion, then you might well be interested in a book that I have recently published entitled Finding Your Own Fountain of Youth, The Essential Guide to Maximizing Health, Wellness, Fitness, and Longevity. Right now this book is available online from Paul Mould Publishing, and for more information go to findingyourownfountainofyouth.com.